Hi everybody, my name is Samantha Hart. I will be presenting on listeriosis. So listeriosis is a sporadic foodborne illness caused by the bacteria Listeria monocytogenes. Uniquely, Listeria thrives in lower temperatures ranging from 4 to 10 degrees Celsius and is tolerant of high pH and high salt conditions. These characteristics allow this organism to grow in diverse environments such as soil, sewages, and refrigerators. Common sources of Listeria are from unpasteurized dairy, deli meats and hot dogs, and fresh produce. High contamination rates have been found in fish and seafood, raw meat, and soft cheeses. The ingestion of contaminated foods is the main method people become infected. This disease is not passed from person to person, with the exception of mother-to-child transmission. Generally, the incubation period of listeriosis infection is 2 to 3 weeks and can last up to 70 days after exposure. It is estimated that many healthy adults are asymptomatically infected as much as twice a year and experience no problems. More likely to suffer are the immunocompromised, children, and pregnant women. Meningitis, neck stiffness, fever, and headache are typical indicators of Listeria infection, along with positive results of bacteremia. Adults are more likely to complain of diarrhea and myalgia, while children show more fever and vomiting. In severe cases, this infection can also trigger uncommon symptoms of ataxia, nerve palsy, and hemiparesis. Listeria infections are especially dangerous in pregnant women as it can provoke spontaneous abortion, affecting about 1 in 20,000 births. The challenge is that maternal symptoms of sore throat, diarrhea, and abdominal pain can be nonspecific, and it can take as little as 2 days before rapidly progressing to miscarriage. An MRI can be completed to recognize the central nervous manifestations of listeriosis, but the chief method to diagnosing an infection is a positive culture from ordinarily sterile specimens of cerebrospinal fluid, blood, amniotic fluid, meconium, or ear swabs. PCR assay tests are more specific and sensitive than cultures in identifying infectious organisms, but they can be expensive. Once an infection is confirmed, antibacterial treatments are prescribed. Although studies have yet to determine the best course of treatment, an ampicillin regimen is preferred. However, many others have also shown susceptibility. Exposure cannot be completely avoided, so food handling precautions and proper storage are crucial to prevent Listeria contaminations. Commonly, outbreaks of listeriosis have been associated with ready-to-eat products such as unpasteurized milk, coleslaw, and butter, and with the failure to properly produce and process foods. Industries are advised to provide health and hygiene training, proper protection for employees, and instruct that employees exhibiting symptoms be excused. Employees' hands should be washed, gloves should be discarded after a single use, and suitable utensils are to be utilized. Certain filtration and water systems are suggested by the FDA for food production plants in order to prevent potential contamination. The FDA recommendations for households focuses on avoiding and preventing the spread of bacteria. At-risk populations are urged to reheat ready-to-eat foods such as lunch meats and hot dogs until steaming, and soft cheeses are to be avoided unless made with pasteurized milk. Raw produce can be tainted, so washing all vegetables and fruit under running water before handling protects from risk of infection. Also, refrigerating or freezing foods and consuming foods as soon as possible will delay growth. Households are also advised to wash hands regularly and sanitize surfaces frequently used in food preparation. Presently, there are no immunizations for listeriosis. However, using a live attenuated Listeria monocytogenes is being explored in clinical trials to elicit an immune reaction. During major outbreaks, a prophylaxis has shown to reduce the incidence of infections. Ampicillin has been useful in treating pregnant women with nonspecific fevers during an outbreak, it could be suggested that providing prophylaxis to HIV-infected persons and those undergoing chemotherapy would also benefit. A confirmed case of Listeria is defined as a person with meningitis or bacteremia, or an infection during pregnancy resulting in fetal loss through miscarriage or stillbirth, or neonatal meningitis or bacteremia, and laboratory confirmed diagnosis from isolation of Listeria monocytogenes from blood or cerebrospinal fluid, or the placental tissue in the setting of miscarriage or stillbirth. Since 1996, the Foodborne Disease Active Surveillance Network, also called FoodNet, has tracked outcomes of labs in 10 state health departments using active population-based surveillance, monitoring for positive results of 9 foodborne pathogens, including Listeria. Listeriosis was deemed a notifiable disease in 2001, requiring all healthcare providers to report positive diagnoses to public health officials. All isolates collected by public health labs are submitted to the National Molecular Subtyping Network for Foodborne Disease Surveillance, also called PulseNet, for whole genome sequencing. Isolates with similar molecular patterns are identified by PulseNet, and with interviews, investigators determine if clusters are detected. The Listeria Initiative, implemented in 2005, collects reports of confirmed cases from labs as part of a surveillance system for investigation of outbreaks in clusters. A standardized extended questionnaire, named the Listeria Case Report, is used to collect detailed information about food exposure and is forwarded to the CDC. The objective of the Listeria Initiative is to aid in the investigation of clusters in order to decrease time between outbreaks and intervention. High-risk populations include pregnant women, newborns, adults over the age of 65, and the immunocompromised, whether from HIV or AIDS, cancer, or other causes. These account for 90% of cases due to their ability to fight off infections. Alcoholics and diabetics are also susceptible because of lowered immune systems, as well as organ transplant recipients and patients with end-stage renal disease. Fetuses are also at risk of acquiring infection across the placental barrier from their mother, who may consume contaminated food. And food handlers are also at an increased exposure to Listeria due to close contact with potentially infected foods. Those with factors increasing their risk of infection also increase the chance of death. A report from the CDC shows 74% of deaths due to listeriosis between 2009 and 2011 had secondary conditions. Listeria Initiative, published in 2013, analyzed reported cases of infection and observed that adults older than 65 have 4 times higher risk of infection, pregnant women have 10 times higher risk of infection, and pregnant Hispanic women have 24 times higher risk of becoming infected with Listeria compared to the rest of the population. Listeriosis infections are considered rare. The CDC expects approximately 1,600 illnesses and 260 deaths per year. As of 2013, the U.S. has had an incidence rate of 0.26 per 100,000 people, compared to the incidence rates of 0.01 and 1.13 per 100,000 people in other countries. The risk of infection is unbiased between races and genders depending on their eating habits. Most pregnancy cases resulting in fetal or infant death has been in Hispanic women, largely associated with culture and dietary practices. Among pregnancy-associated listeriosis cases reported to the CDC between 2009 and 2011, 43% were Hispanic mothers. In this figure, Listeria is shown in red. A stable trend is noted in Figure 1, displaying incidence rates by age group. The incidence of Listeria is constant until about the age of 40, when the rates of infection exponentially increases, peaking at about 80 years of age. Approximately 9% of Listeria cases are newborns, 20% occur during pregnancies, and the rest occur over 40 years of age. For this table, I've highlighted listeriosis in green. The World Health Organization states that in regards to Listeria monocytogenes, these outbreaks are worldwide with sporadic incidents. Similar statements have been made from the Center for Food Security and Public Health, remarking that Listeria is widely distributed in the environment. In the 2012 FoodNet surveillance report, it was recorded that a total of 123 reported cases of listeriosis. One had stated they had traveled internationally before their illness, while the remaining 122 cases, or 99.1%, did not travel out of the country, suggesting the majority of the cases ingested contaminated foods within the United States. Listeria is represented as the dark red dashed line. Ward and colleagues noted in the report on listeriosis that there is no seasonal pattern of incidence. The FoodNet surveillance report charted the trends of infection each month in 2012, showing little pattern over seasons. The peak of infection is noted during July through September, most likely due to consuming ready-to-eat foods more often through the summer months. In this last figure, Listeria is represented as the black dotted line. Outbreaks of Listeria are rare and sporadic. As this figure displays, there was a decline in incidence rates of listeriosis by about 42% when comparing data from 1996 through 1998 to 2012. But since 2006, incidence rates have remained stable. The CDC defines a foodborne outbreak of listeria as 2 or more people getting sick from the same contaminated food or drink. An average of 2 outbreaks per year occur in the United States. In 2011, the U.S. had their largest listeria outbreak associated with contaminated cantaloupes from a farm in Colorado. This outbreak affected 28 states, leading to 147 illnesses, 1 miscarriage, and 33 deaths. According to the CDC, the most recent outbreak of listeriosis was related to raw milk from an organic farm in Pennsylvania. Products made from the unpasteurized milk has been responsible for 2 hospitalizations, one of which fatal, in elderly consumers in Florida and California. A notable outbreak involved Mexican-style cheese in California in 1985. Most of these cases were perinatal infections in Hispanic women. This particular outbreak established Listeria as a high-priority pathogen for food disease. Sources of Listeria have almost always been foodborne. However, 1 case of nosocomial transmission has been reported. In Costa Rica, 9 infants were infected after being bathed using contaminated mineral oil that had been previously used on an infected infant. Lastly, due to the rarity of listeriosis and the lack of the ability to perform controlled, randomized trials, researchers have been unable to find favorable treatment routines and durations to recommend. As noted before, Listeria infections respond to many types of antibiotics. However, it has been documented that a resistance to cephalosporin treatments exist. Thank you, everybody. This has been my presentation on listeriosis. I look forward to comments and feedback. Thanks again.